remember the first time I met you was in a room where you were presenting to try to get funding from a peer-reviewed committee. And I remember thinking, this is fascinating, because it was with some of the top cardiac and thoracic surgeons at Baylor. And here you are, a PhD, you walk in, so you're not a surgeon, you're not part of the club that
Right.
these guys are part of. And I was laughing because what you were selling, it was the lawnmower study that you were trying to get
Right.
money for. So tell us about how you presented that, because that was just, I'll never forget that.
Well, that when somebody has a bypass surgery, their sternum or their breastbone is cut open, and when they get finished with the surgery, they sew that back together. So some of the guidelines that they're given after their surgery are not to lift more than 5 pounds. And that causes a great problem for us, because we went around and measured like doors of the hospital and suitcases and car doors and everything, and almost everything weighs more than 5 pounds, but that's what the advice is that the patients get after the surgery.
So I'm not allowed to lift 5 pounds, but when I go see my doctor for a follow-up visit, I have to open the door
Exactly.
to his, and it's 10 pounds of force.
Well, exactly, and we actually, our cardiac rehab door is 14.5 pounds, so if they went by the rule, they'd all be standing out in the hall.
outside
Yeah,
knocking.
they wouldn't be able to come in. But this is the thing, is that it sounds like a silly thing that I'm trying to sell the surgeons, but what changed my life was, and I want to tell you a little story, if you don't mind.
Yes, please.
When you go to college and get a degree in exercise physiology, you learn how to lift weights, and you know where all the muscles are connected on your bones and everything, and you come out of there and you know how to train people appropriately. So if I were to train you, I would size you up, figure out how strong you were, and train you for what you needed specifically. But you get into a cardiac rehab arena, into a department, and you're told you can't think. You just have to give them 1 to 5 pounds, no matter whether it's a 90-year-old grandma or a 40-year-old firefighter. And it sounds like no big deal, and people say, why are you so focused on this? But it is a big deal, and I'll tell you, the last guy that was affected by this in my time at Baylor there was this 39-year-old man. He's sitting across the table from me, and we're talking, and he just has that look on his face. He's depressed, and he was doing well after his surgery. But I said, what's wrong? Why don't you just look down? What's going on? Are you not having a good rehab stay? And he said to me that he was told not to lift more than 5 pounds, and his job at the apartment complex that he was the maintenance man for, he has a toolbox, paint cans and that sort of thing. So he went back to the maintenance complex and told him what his job restrictions were, and so they fired him, and he's 39 years old, and that complex was giving him an apartment to live in, so he lost his apartment,
Oh,
he lost his
no.
job. And so basically that was my light bulb moment where I said, not one more man or woman is going to have this happen to them on my watch. And I said, that's it. I'm not doing this anymore. And that story and that man gives me the strength to go in and talk to the surgeons, because that's a little bit scary to talk to them, because they're the ones that usually say don't lift more than 5 pounds. But I've asked them, and they don't know where it comes from necessarily. It's just this weird common thing that people across the whole nation say, and it comes from nowhere.